window of opportunity. The rapid and physical cognitive development that marks adolescence create a critical window of opportunity. The adolescent's brain develops at a rate unseen since early childhood, making girls and boys hypersensitive to influence in their environment. Adolescents' inclination to try new things can spark innovation and achievement, but it can also leave them vulnerable. These are the years when gender roles may be solidified, with girls bearing the brunt of gender inequality. Adolescents' prospects depend on the quality of their environment, relationship, and experiences, the care and support they receive, the services they can access, the social norms that guide their communities, and the extent to which they can influence decisions that affect them all make difference. It says that teenage brings us many changes, but not only physical but also mentally and social. During these years, adolescents increase their ability to think abstractly and eventually makes plan and set goals. Sinasabi lang dyan na during teenage natin, dito tayo na nagmamature. Hindi katulad ng mga bata tayo. Dito, yung teenage natin, dito tayo nagkakaroon ng set of goals. Yung pag-iisip natin, hindi na siya katulad ng bata tayo na kunwari na lang tayo as a teenager, meron tayong mga set of goals nga kaya tayo nag-aaral para makatapos ng pag-aaral. Syempre matulungan din yung mga magulang natin. Next.
UNICEF takes life course approach to adolescent development and participation, identifying critical and opportunities that have implications for the realization of children's rights. From the first decade through the second, we address gaps in data to build evidence and drive action where it is the most needed. With the governments and other partners, UNICEF works to strengthen healthcare, education, and protection systems and ensure critical supplies and service reach the last mile even in emergencies. UNICEF support child health and nutrition and safe water and education and the protection children and adolescents from violence and exploitation. Ito mas inaano nila na mas ma-provide nila yung pangangailangan ng mga bata na kung ano yung right nila. Next slide.
UNICEF works with health providers to support gender-responsive services tailored to adolescents' needs, including for HIV prevention and treatment. We support nutrition to fuel developing bodies and brains, work to ensure that girls have what they need to manage their menstrual health and hygiene, and generate evidence on adolescent mental health. As explanation ko dito, UNICEF also can collaborate with healthcare professionals to provide gender-responsive services such as HIV prevention and treatment. Because most of the patient of HIV is a woman, and also that it tailored to the needs and of adolescents. We aim to ensure that girls what they need to manage their menstrual health and mental health also for their cleanliness for their bodies. UNICEF works with governments and other partners to expand and protect access to quality, gender equitable education and to improve student participation and learning. We work alongside adolescents to co-create solutions that support their transition into adult life and work, like traditional and non-formal paths to education and skill development. Also, UNICEF collaborated with governments. They need support for government to financial also to support children and other partners to increase student involvement and learning, while also expanding their education and learning and knowledge for their educational, because most of the teenagers most of the time is lack of knowledge because they don't have financially for their education. We collaborate with teenagers to build solutions that help them move into adulthood and to have a work. Yun lang. Next slide.